Hi, my good people. Dr. Hanna Cespedes here again from the one and only Pacific Accounting and Psychiatry. I want to nerd out with you guys today. And to be honest with you, I want to talk about a book that I recently finished. If you guys are anything like me, I tend to have a few different books going on at the same time. I don't know if I'd say if it's a bad habit, it's just a habit. It's got positive things for my life and also some negative things as well. However, when I picked up this specific book, I put down all the other books and texts that I was reading for fun, for pleasure, for clients, and this was one book that I solely devoted my entire brain to, which I'm easily distracted and can feel and be sporadic at times. So that's saying a lot for me to be able to do that. However, this book, it really stood out. I started reading it for fun because I had just finished a really deep theological text on attachment and psychotherapy by David Wallen. Go check that out for all of you fellow nerds out there in attachment science. So I wanted a book that was going to be a little bit more light and fun. I like to run and am working on my first marathon in May. So I was like, okay, let me check out books about running, and was recently recommended a book by Sally McRae. And if you know anything about Sally, she is one of the best endurance athletes out there. She does ultra marathons like they're nobody's business. She's been doing them for over 20 years, and she has an amazing book and podcast as well. The book is called Choose Strong, and so is her podcast. So check it out. But today I really want to specifically talk about an idea that has stayed with me since finishing this book. Like I said, I have usually 5 books that I'm reading off and on throughout the week for different purposes, for pleasure, for a client, for a student, for classes I'm teaching. But this book really just captivated me. So before I get into that, I want to make it very clear that this is not therapy. I am not trying to give mental health advice. This isn't a substitute for working with a professional. And at the same time, this is my personal reflection, my clinical reflection from being a therapist, from working significantly with attachment wounds, family trauma, survivors of trauma. As a therapist, I utilize trauma-informed lens and an attachment work. So I didn't know that this book was going to be so impactful for me clinically when I picked it up to read personally. The book itself starts with this concept of choosing strong, and it's not exactly what you think. But again, this book tends to shock you a little bit. And if you're someone who has experienced trauma in the past, or especially early in childhood, parts of this may really resonate with you. And if it does, I want you to know that you're absolutely not broken and you're not alone. And that Sally McRae does a wonderful job in her book detailing and describing that. What struck me most about Sally's story wasn't necessarily about her endurance or physical grit. That speaks for itself. As an athlete, as a competitor, I really admire that about her, and that she's been able to sustain it for so long. What struck me significantly was her vulnerability and honesty about her childhood and her abuse and her suffering. It hits you in the very first few chapters. She talks about her abuser, who's a parent of hers, being a kind, loving parent one minute and then turning into a monster. And she uses this analogy of, where did my daddy go? The monster is now here. The monster is looking at me. Daddy's eyes have disappeared, and now the monster's eyes have replaced them. And as I was running, listening to this chapter for the very first time, I had it on Audible. I just started crying in the middle of my run, because I hear this time and time again from my survivors of abuse growing up, is that it feels as if there are 2 people when you have a caregiver or a parent who's the one physically harming you or emotionally harming you in any kind of way. And she was so honest about it and so vulnerable in describing from a very young age the experience that she had, the internal experience of going through this challenge in a big family in a time that abuse was not often talked about. And she ties in this idea of choosing strong. And it's because when we talk about our strength, we often usually think about pushing through, gritting it out, bearing through the pain, being more resilient. But trauma, especially childhood trauma, really complicates that narrative. Again, I'm a trauma-informed therapist. I work a lot with survivors of trauma and those who have gone on and have done what I call the impossible. You survived the worst of the worst. You experienced suffering at the hands of a caregiver. And in terms of the animal kingdom and biology and evolutionary science, we weren't supposed to make it through that. We weren't supposed to survive, but we did. And so by the time I'm usually sitting with someone in my office, we talk about that narrative and how for so long, the years of pain and suffering, we did have to just grit and survive and push past it, dissociate at times, disconnect at times, depersonalize at times. But strength looks different depending on your season of survival. And so by the time folks are coming into my office to see me and begin our working relationship, we're in a very different season of survival than someone who's actively in the middle of a crisis or actively in the middle of experiencing abuse and suffering. Thinking more in terms of childhood trauma in the nervous system. Again, Sally does an amazing job breaking this down in her book on choosing strong doesn't mean that children cope effectively. Children cope as best as they can with the experience going on. Children are highly adaptable. Another text I'm reading currently references children as one of two types. You either have orchid children or dandelion children. Dandelion children tend to be the kids that are more easygoing, that stay out of trouble, don't have too big of feelings. They're just very easygoing, and no matter what is going on around them, they'll sort of always seek consistency, normalcy. Whereas orchid children, those are going to be your highly sensitive, highly aware, empathic. At times, society would probably judge them as too much, as dramatic, right? But orchids, if you know anything about plants, and I do not have a green thumb, but I do like plants. Orchid children tend to be the ones that can achieve the most artistically, but also suffer the greatest if their needs are not met. And so from a childhood perspective and from an attachment focused lens, children don't choose how to cope. They don't choose what kind of child they are, orchid or dandelion. And when you, from day one, experience trauma, experience abuse and suffering, your main job is just survival. You don't get the luxury of learning how deep breathing works. You just try to survive, and the brain adapts to that. The nervous system becomes on hyper alert. We become so in tune with the noises and experiences associated with the individual who's harming us, such as, and I've heard this many times before, and Sally talks about it in her book, that survivors, children who are currently in, experiencing abuse and harm in the home, they can tell the level of emotion or anger, for example, by their abuser by the sound of the footsteps they hear from the parent walking from the car to the door, that by simply glancing at the face of the caregiver who's abusing them, they can tell in a split second if they're about to blow up or not. And that becomes a way to adapt, to survive. That can look into people pleasing, to becoming the fixer, to avoiding at all costs. The body learns to brace and the brain prioritizes survival over connection. That is quite detrimental long-term. And I want to make that very clear, because in a normal, not perfect, but in a normal welcoming, safe home, the child will always choose safety and security with a caregiver over environmental safety and security. This is attachment science 101, that a child, if given the choice, if they had to make a choice, will always lean towards the relationship over physiological safety. This is why some individuals who experience pain and suffering like this form of abuse from a young age, get told that they're sort of like the horrible comparison of, an abused dog who goes back time and time again to their abuser. Is that what's a child supposed to do from a young age? They have to survive, and they will choose the caregiver. For the vast majority of it, the abuse has to get quite intense and quite severe for the child to walk away, to run away, to seek something else. It's a big reason why so much childhood abuse goes underreported, one of the many reasons. So overall, we see in those who survive childhood abuse, we see things like hyperindependence, emotional suppression, perfectionism, overachievement, physical toughness, or numbness. We were describing that a little bit ago, and Sally again touches on these themes so eloquently in her book. And they're not flaws, they're not failures of the system. They're actually a painfully beautiful way that the child survives and gets through those challenging years. They're survival skills. And they're survival skills that make it complicated as an adult. And that the very thing that kept us alive as kiddos now become the challenges that deter us from long-term happiness, success, fulfillment, longevity in our adult life. Survival strength often looks like endurance. It can look like silence and self-resilience and emotional control and pushing through the pain. But the healing, true art of healing, looks very different. We have to learn, and Sally talks about this in the second half of her book, sort of this contrasting of growing up, having to survive, having to cut down, stay quiet, using her voice, enduring pain as a child, going numb, dissociating. As an adult, we have to begin to learn how to feel again. We have to learn how to be honest rather than be tough, and to be present rather than performative. And so these are juxtapositions that sound easy on paper, but for the survivor of trauma, they're some of the most challenging things. But a way, maintaining a strength-based perspective that I like to do is to flip it and say, well, again, we survived the worst. Things used to be a lot harder. That doesn't take away the pain and challenge of what today is, but I hope it serves as a template to encourage you that you can do hard things and that you can endure, and that now no more enduring is needed. We just get to heal, and healing can sort of feel like an endurance of its own classification. And probably what connects me so significantly with this book is her connection to running, to athletics, to competition. I started reading this book to learn more about endurance running and to better help me in my training, and was so shocked by the overlap between my clinical life as well. Because as an endurance runner, I've learned that real strength is not about punishment. It's about partnership with the body. And trauma teaches our body to brace, to tense, to hold, right? Hold our breath. Whereas healing teaches the body to trust, to let go, to be rather than to do, human being rather than doing all the time. That we have to listen to our body, this idea of intuitive running. We all have our smartwatches, our apps that track our running and heart rate and tells you what to do and how to do it. And all of that can be very helpful. However, trauma healing and trauma recovery at its core is learning to reconnect intuitively with your person, with your body, with your brain, with your wants and desires, and with your pain as well. And learning how to rest and be, and you view that as strength. Choosing strong, by the way, is choosing strong in this idea of being and resting rather than having to go and do. And that repair is a part of the process. And again, that's a huge trauma theme. Judith Herman talks about that, repair, recovery, ideology, and theme in her text as well, which I would read both of those clinically if you're interested. It's one of the best trauma books provided, I think. And so, the strongest athletes aren't the ones who never rest. They're the ones who respect the recovery. And that healing asks us to redefine our strength without constantly pushing, but as an attunement, as attuning to what's going on in our body, what's happening, what are we experiencing. And so this idea of choosing strong, right? Choosing strong does not mean gritting it out. As Sally talks about, healing strength is not about proving our resilience. More so it's about allowing safety and choosing boundaries, choosing rest, choosing honesty and vulnerability over performance, choosing to view ourselves as strong no matter what state or experience we are going through or have gone through. She did a tremendous job describing this in her book. And again, as a therapist, as a person, as a human reading this and listening to her words, I was so struck by the power of her reflections, detailing it from childhood to now. And so if you have also experienced childhood trauma, you're already strong. You do not need to prove yourself anymore. That healing is not weakness. Taking ownership in your life does not mean that you have failed in some ways. It's evolution. It's adapting to this new season of living, not just survival. You don't need to earn your rest. You don't need to justify your pain. And you certainly don't need to keep surviving in what you no longer live in. If you're having a hard time with that, reach out to a therapist, reach out to someone you trust, reach out to a pastor or priest of some kind. Reach for the Sally McRae book, Choose Strong, as well. And as we reflect together and you think about what this may mean in your life, I would encourage you to think about, what does choosing strong mean in your specific season of life right now? Thank you very much, guys.